Hello and welcome to Itenef Healthcare Solutions webinar, Demystify the API. This webinar is going to be fire. My name is Chelsea Grover and I'm the Marketing Communications Manager for Itenef. Before we get started on today's webinar, I wanted to take a moment to explain the process for the presentation. First, I'd like to mention this webinar will be recorded. We'll send out a copy of the slides and the recording within the next week. Next, for those of you who aren't familiar with Itenef, I wanted to share a bit of who we are with you. We specialize specifically in next-gen healthcare. We're passionate about providing solutions for our healthcare provider partners, which in turn help them to improve patient care, enhance the patient experience, and maintain a financially healthy practice. To sum it up, we do everything next-gen. We also have add-on productivity solutions for next-gen, including ChartCard, Refund Manager, Unapplied and Deposit Manager, and Multiple Encounter Billing Manager. Next, I wanted to mention some upcoming webinar topics that you can expect from us soon. On September 22nd, we'll be presenting Streamlined Patient Intake using Instant Medical History in NextGen. If your practice is getting bogged down with the traditional timeline for patient intake, then this will be a great webinar for you. Join us while we cover an easily adaptable NextGen functionality that could maximize office efficiency. Then in October, we'll be presenting Deep Dive into NextGen's Patient Experience Platform. So keep your eyes out for invitations to those webinars and follow us on LinkedIn to be the first to know about them. Okay, so back to today's webinar on Demystify the API. At the end of the presentation, we'll open the floor up to questions from you. We'll answer all the questions at the end, but you can type them in the questions area of the webinar control panel whenever they occur to you. And finally, for audio clarity purposes, everyone's phone will remain muted throughout the entire webinar. If you experience audio issues, please use the chat box to let us know so we can resolve them. And again, questions may be entered in the questions box. So, without further delay, I'd like to introduce our presenters for today. Lindsay Lanning is Manager of Client Development, and Helen Lively is one of our consultants at Itenef. So since they're both so eager to get started on this one, I'm going to go ahead and hand it off to Lindsay. Lindsay, feel free to get started when you're ready.
Great. Well, thank you, Chelsea. And hi, everyone. Thank you for joining us for our webinar, Demystify the API. Now, I hope it's going to be fire, but we will leave that for you to decide. I just never pass up the opportunity for a good pun. Now, I'm sure all of you have seen or heard the words API or FHIR lately. I know my inbox has been flooded with these acronyms, which is what gave me the idea for this webinar. Everyone is supposed to know what these mean and what they are. It's a given in the industry right now. It is as common as saying EHR or HIPAA. And if you don't know what those stand for, well, that's awkward. But now I feel I need to be very honest with you all. I feel like after it's probably been about 6 years now of webinars together, I consider us to be pretty close. So I'm going to confide in you and share a very deep, a very dark secret. I'm going to be brave and not be afraid of judgment and stand up for all those people who are in the same boat as I am, and finally admit that I have no idea what API or FHIR or any of it all means or what it meant. I know I told you it was bad, and you might be thinking, how did she get away with it for this long? Well, every time someone brought it up in conversation, it was a lot of me saying, sure, and some very vigorous head nodding. And then it shifted to the, well, I'm not actually very technical excuse. Does any of that sound familiar to any of you on the line? No need to raise hands. This is a safe space and you can remain anonymous. But then eventually these terms actually invaded my happy place, healthcare regulations. And I couldn't hide from them any longer. And I realized I had to figure this out. So if you too have been dodging the proverbial API bullet and are just barely getting by with excuses, don't be ashamed. We're glad you're here. We are going to introduce the basics of these healthcare concepts, exploring what they are, what they do, and most importantly, how they're going to impact your medical practice due to the 21st Century Cures Act. So I will preface, we plan to educate on the fundamentals of this topic from people who don't have to know all the ins and outs and intricate details as part of our daily responsibilities. If this also sounds like you, stay where you are. If you already know what all of this stands for, how it works, and the basics of the NextGen program, you may be very bored for the next hour. So let's start with when I finally hit the peak of my API denial and I realized the fake it till I make it method just wasn't going to work forever. I actually started to ask myself these questions. What is an API and how does it work? What's FHIR? And what's a FHIR-based API? is FHIR and HL7? What's the difference between HL7 and API? What's this patient access API I keep hearing about? How are these going to enable interoperability? What's going to be required of our next-gen clients? And where does the Cures Act fit into all of this? And as I started my research, I realized I should share what I find because I'm sure I'm not the only one in this situation, which is when I decided to make this webinar, which is exactly when I was able to answer my very first question. Am I playing with FHIR by opening this can of worms and hosting a webinar on a topic I don't fully and completely understand yet? And the answer is yes. Yes, you are, Lindsay. So let me be clear. The goal by the end of this presentation is to understand this graphic, what it means, how it really works, and be able to engage in an intelligent conversation on it. So why not start with a term we all know and understand, the precursor to API, at least in my mind, and the ultimate goal of APIs and what they're trying to accomplish, which is interoperability. Well, what is interoperability? So according to HIMSS, interoperability describes the extent to which systems and devices can exchange data and interpret that shared data. For two systems to be interoperable, they must be able to exchange data and subsequently present that data such that it can be understood by a user. Now, AHIMA says interoperability is the ability of different information technology systems and software to communicate, to exchange data accurately, effectively, and consistently, and to use the information that has been exchanged. But why is this so important? Well, the ability of different information technology systems and software applications to communicate, exchange that data, accurately, effectively, and consistently, and to use that information that has been exchanged in healthcare is crucial right now. True interoperability is going to actually enable different systems to communicate and exchange data in a usable way. That's key. This is a necessary step forward in transforming healthcare into a system that can actually achieve goals of improved quality, efficiency, and most importantly, patient safety. So some examples of interoperability in healthcare are things like viewing results from diagnostic procedures conducted by other providers to avoid duplication, evaluating test results and treatment outcomes over time, regardless of where the care was provided, to better understand a patient's medical history. Viewing complete medication lists to reduce the chance of duplicate therapy, drug interactions, medication abuse, or other adverse drug effects, and identifying important information, think allergies, pre-existing conditions, for maybe unfamiliar patients during an emergency treatment to reduce risk of any adverse reactions. Now, that sounds great. So what's stopping this from becoming reality in healthcare? Who wouldn't want this? Well, the current barriers to interoperability are things like lack of mandated health data standards. There are differing state privacy rules or requirements. The inability to actually accurately match patients' health records. There's also the costs associated with the technology to achieve this, or even the cost of time and resources to implement these new technologies. And last but not least, acts of information blocking. So you'll notice the items I marked in blue on the last slide. Those are lack of mandated health data standards and information blocking. And those are officially barriers that are being torn down by the 21st Century Cures Act. Now, I'm not going to deep dive, too much into this rule since we did an entire webinar on this previously, which is actually posted on our website if you're interested. But it's important to at least explain the fundamentals in relation to APIs and FHIR. So first off, you need to know there are actually two rules involved with this. One was released by the ONC, and it's actually called the 21st Century Cures Act, Interoperability, Information Blocking, and the ONC Health IT Certification Program. And then a second rule was actually released by CMS, and it's called Interoperability and Patient Access Rule. And both of these work together and impact the use of APIs in healthcare and medical practices achieving interoperability. The first one, released by ONC, was created in response to information blocking and the need for interoperability. So this rule specifically prohibits interfering with access, exchange, and the use of electronic health information, which means it promotes health information interoperability. It's designed to give patients and their providers secure access to their EHI, and it actually aims to increase innovation and competition by fostering an ecosystem of new applications to provide patients with more choices in their healthcare. As well as, and in the case, this specific case I did save the best for last, adopt standardized application programming interfaces or APIs, which will help allow individuals to securely and easily access structured electronic health information using smartphone applications. So before we dive into APIs, we need to understand what information blocking is so we know how APIs work to prevent this. Specifically in these rules, they provide a definition of what information blocking is, and it's defined as the intentional withholding of patient health information or anything that interferes with access, exchange, or use of EHI. It's also important to note that information blocking is not a requirement to proactively make all EHI available. It's focused on providing data to those who request it in a way that they want it. And lastly, most importantly, who does this affect? Well, it's going to affect what the rule calls actors. And actors are made up of healthcare providers, health IT developers, and health information exchanges. Now, there are 8 exceptions to this information blocking rule. The exceptions are split into 2 classes. The first one being exceptions that involve not fulfilling requests to access, exchange, or use EHI. And the second is exceptions that involve procedures for fulfilling requests to access, exchange, or use of EHI. So exceptions that involve not fulfilling these requests include the preventing harm exception, which I'm sure most of you have heard of. This is to actually engage in practices that are reasonable and necessary to prevent harm to a patient or another person, provided certain conditions are met. There's the privacy exception. So this is put in place in order to protect an individual's privacy, provided, again, certain conditions are met. There's the security exception. Again, same thing, where the goal here is if you were to release this information, it would possibly endanger the security of the EHI. There's the infeasibility exception. This would be due to the infeasibility of the request coming from the patient. It's infeasible to meet. There's also the health IT performance exception. So this is to take reasonable and necessary measures to make health IT temporarily unavailable or impact the overall performance of the health IT to provide that information. So maybe, you just had an upgrade and that information is not available at this second. That's where that idea is coming from for that one. Now, the second class, which is going to be the ones that involve procedures for fulfilling requests, there's 3 of these. The first is content and manner exception. So this is actually going to limit the content of the response to the request for access, exchange, or use of that information, or the manner in which it fulfills the request for that EHI. There's the fees exception. So this is focused on charging fees, including fees that result in a reasonable profit margin for the exchange of this information. And then lastly is the licensing exception. So to license interoperability elements for the EHI to be accessed, exchanged, or used. So these are all valid reasons to not share information without information blocking. Again, this was a really high overview. We did cover this in our other webinar, but just keep these exceptions in mind for later in the webinar. There are valid reasons to not share that information when it's requested without actually participating in information blocking. So from a patient perspective, the Cures Act is going to allow them to access their records much easier while also keeping their information safer with the new technology requirements. It also is going to promote the ability to shop around for care and maybe manage costs better by expanding patient and payer choice. That's going to happen when we increase that availability of data that can support insights about care quality and costs. Now for providers, this should, in theory, make patient data requests easy and inexpensive and allow for greater choice in apps that work with your EHR, all the while working to improve patient safety with greater data transparency. Now for developers, ONC has established specific API conditions of certification that address the practices developers of certified health IT, what they need to engage in with respect to that certified API technology. So Per the 21st Century Cures Act, the API conditions of certification seek to actually minimize what they refer to as special effort necessary to access, exchange, and use that EHI via certified API technology. So these conditions include three things: transparency conditions, permitted fees conditions, and openness and pro-competitive conditions. So the transparency condition, this is going to require certified API developers to publish specific business and technical documentation necessary to interact with their certified API technology and make that documentation publicly accessible via a hyperlink. Now the permitted fees condition, so with respect to that API technology, this condition is going to set criteria for allowable fees, guidelines for the fees for certified API developers that they would be permitted to charge, and then also to whom these fees could be charged to. And then the last one being the openness and pro-competitive conditions. These are going to establish practices that API developers must follow to enable an open and competitive marketplace. In general, these developers must grant API information sources and the independent ability to permit API users to actually interact with the certified API technology deployed by that API information source. Now, switching gears a bit to the second rule released in association with the Cures Act. So that's going to be by CMS. And it's going to include the use of APIs to expand data sharing and transparency among CMS regulated payers. And these are going to start in January of 2023. Overall, it can be summarized in about 7 policies, as you can see on the screen. So a summary of the new policies and its possible impact on payers and providers are as follows. So we're going to start with payers. The first one being the Patient Access API. So Medicare Advantage organizations, Medicaid fee-for-service programs, and Medicaid managed care plans are going to be required to implement and maintain a secure, standards-based API that allows patients to easily access their claims and encounter information, including cost, as well as a defined subset of their clinical information through third-party applications of their choice. You then have the Provider Directory API. So payers are also going to be required to make provider directories publicly available via an API. This, intent of this provider directory API is to actually help patients find providers for care and treatment, as well as help clinicians find other providers for care coordination in the most, what they deem user-friendly and intuitive way possible. You also have the payer-to-payer data exchange. So payers are required to exchange certain patient clinical data, specifically the United States Core Data for Interoperability, version 1 data set. That's the USCDI, if you've been hearing that associated with the Cures Act at all, at the patient's request. So allowing that patient to take their information with them as they move from payer to payer. And then lastly, on the payer side, improving the duly eligible experience by increasing the frequency of federal state data exchanges. So that's going to actually increase from weekly or monthly as it is now to actually a daily exchange. Now on the provider side, 3 things here. First is public reporting and information blocking. So I'm sure you've all heard about this. The deadline has passed. CMS is going to start publishing a list of providers or clinicians who act as information blockers, and a list based on provider performance to promote the interoperability program, which is under MIPS. The digital contact information requirement. Again, CMS stated they're going to start reporting providers publicly who do not list or update their digital contact information in the National Plan and Provider Enumeration System, or your NPES account. And lastly, admission, discharge, and transfer event notifications. So this requires hospitals to actually send electronic patient event notifications of a patient's admission, discharge, and/or transfer to another healthcare facility or provider. Now, the CMS rule does much more than that as well. As a result, they actually developed this graphic outlining some of the major milestones in the rule. So you can see the 2020 milestones. These have already passed and are currently required. The information blocking rule was published. Providers have to, update their contact information in NPES, and there's the public reporting of any information blocking. Now, the 2021 milestones include sending those hospital event notifications. Payers have to put in place that patient access API and provider directory API that I just talked about, as well as testing plans are due. That's on kind of the back end here that they need to send to ONC. Now, some of these deadlines coming up may have already occurred, or some of them could have actually been delayed due to the public health emergency, but those delays aren't going to be indefinite. So things like certification, you see HL7 FHIR APIs in 2022. You see payers have to implement a process for payer-to-payer data exchange. Some states have to send dual eligible enrollee data to CMS daily. And then in 2023, you can see that certification of HL7 FHIR EHI export and participation in the Trusted Networks for Health Information Exchange, or TEFCA, what we've seen there. So you can see, like I said, some of these have passed, or some of these deadlines may be delayed due to the public health emergencies, but this is coming. This is where the healthcare industry is going. You can see just based on the items in light blue on the slide here that understanding what APIs and FHIR mean is crucial to our success in the future of healthcare. So let's look at APIs first. I'm sorry I kept you kind of all on a string here to really get into the meat of it, of what an API is. So what do we do when we don't know the answer to something? Well, we ask Alexa while I'm making dinner, or we Google it, which is exactly what I did for 3 weeks straight, over and over again. And what I learned was that the expression, there's an app for that, will soon be, oh, there's an API for that in the healthcare arena. So what is an API? Well, API stands for Application Programming Interface. An API is an intermediate software that's going to allow dependent applications to communicate with each other. So APIs provide a set of protocols, routines, and developer tools that will enable software developers to extract and share information and let applications interact in an accessible manner. So explaining that without any technical jargon and acronyms, an API is software that bridges two or more applications, allowing data to flow irrespective of each application's original design. So if we take it up a notch a little bit towards the technical realm, it's going to be a set of some sort of subroutine definitions of communication protocols and tools that are going to make it easier for software developers to develop programs in blocks that can be later put together. So an API can also facilitate communication between systems by opening up access to individual components for developers and partners so that separate programs can actually communicate and work together. So in the simplest terms, as promised, an API is a software that sends information back and forth between a website or app and a user. And these are among the fastest growing software technologies in the world, influencing the way we work and play in the real world and interact with each other online, and are very quickly becoming the backbone of connectivity within healthcare. So APIs communicate through a set of rules that define how computers, applications, or machines can talk to each other. For apps designed to, continuously pull data streams from multiple sources, APIs serve to actually decrease development time and save storage space on endpoint devices, and also overcome differences in standards or programming languages among systems. So the ability of APIs to really optimize interoperability and manage information flow is one reason for the vitality and continued growth of the so-called app economy that we're in right now. So this is going to act as a middleman between any two machines that want to connect with each other for a specified task. So I'd take a second. Imagine back in the day, before cell phones. Yes, I was alive. You're in your house and your mother is in a house down the block, and you need to ask her for a recipe, but you're way too busy to run on the road yourself. So you send one of your kids with a message for your mom. Your kid runs down there, gets the recipe, and brings it back to you. In this example, your kid is the API. Simple as that. You stay where you are, your mom stayed where she is, and your child brings the message to her and then brings her response back to you. It really is that simple. So let's take another step back from healthcare and look at an industry where APIs have been in use for years. One prominent example of the APIs which we encounter in our day-to-day life is the log into your account with Google, Facebook, Twitter, Instagram, whatever it is, functionality that you're going to find on several internet platforms. These APIs are going to let the host application or the host website interact with your social media accounts and make the login process much easier. Maybe it's the millennial in me, but this really made things click for me and was my kind of aha moment that made APIs both, much more understandable and also less intimidating. Now, there are different types of APIs, and they come in, many shapes and forms, which once a developer actually chooses among a variety of APIs, they're going to base those API protocols and standards on the purpose of what they're making that API for. So the common API types are going to include either a REST-based API, a SOAP-based API, what's called a GraphQL-based API, an XML RPC, or a WebSocket. Don't worry, I'm not going into all of these types of APIs. I will focus on the one that is used in healthcare most often, which is the REST-based API. And these are, data-driven architectural style of API development. REST is going to stand for Representational State Transfer, and it's a web-based API. It's based on Uniform Resource Identifiers, or URIs, and HTTP protocol. That should sound familiar. And REST-based APIs actually use JSON for data formatting, which is considered to be browser compatible. These are simple when it comes to building and scaling as compared to other types of APIs, and they actually help facilitate client-server communications with ease and smoothness. Now, some of the major benefits of APIs in healthcare are going to include things like security, more storage space, and data exchange tracking. So APIs provide security without limiting access to patient data across devices and platforms. It's going to protect the patient information from malware and other external threats while ensuring that health information is given to the proper users. APIs also allow developers to build applications faster and more efficiently while being much less likely to receive any sort of data breaches or security errors. More storage space. So I mentioned this before, but healthcare programs that are constantly interacting and exchanging information with each other, with an application that's constantly pulling data from multiple sources, it can take up a lot of space on a device. So APIs actually save storage space on devices and decrease that development time. And then data exchange tracking. Put it simply, with APIs, you're always going to know exactly what source your data is coming from. So with that, I will go ahead and hand it over to Holland to explain the basics of HL7 FHIR.
All right, thank you, Lindsay, for that informational introduction to some APIs. So as Lindsay mentioned earlier, we're going to be taking a look at the HL7 standard FHIR. One really important thing to keep in mind as we work through the basics of FHIR today is that the CMS Interoperability Final Rule requires that member data access must follow the HL7 FHIR standard for the electronic exchange of healthcare information. So as I just mentioned, by May 1 of 2022, that CMS Interoperability Final Rule is going to require following that HL7 FHIR standard. And basically, just by having regulations define and require interoperability using that FHIR standard, we can expect a more unified and an easier integration process across EHR applications and vendor systems over the next few years. So now that we have the regulatory stuff out of the way, sorry, Lindsay, what is FHIR? FHIR, or the Fast Healthcare Interoperability Resource, is a standard developed by HL7. It serves as an open source HL7 standard for exchanging healthcare information electronically. Basically, it provides a means for representing and sharing information among clinicians and organizations in a standard way, regardless of the ways local EHRs represent or store their data. So now, what is a FHIR-based API? A new generation of API-based interoperability standards is emerging. The FHIR standard specifies many low-level data access services that can be used as quote-unquote building blocks to assemble more complex interoperability functionality. FHIR creates a common set of APIs so healthcare platforms can communicate and share data across facilities in a manner that each platform can understand. This exchange specification defines how the resources are exchanged and managed. This can be achieved in the form of real-time representational state transfer, those RESTful APIs that Lindsay mentioned earlier, as well as messaging and documents. RESTful APIs are going to allow for the exchange of FHIR resources using HTTP requests. So it's important to note the difference in HL7 and FHIR. And by now I'm sure you're wondering, what is the difference? So FHIR is a standard for healthcare data exchange that was published by HL7. So HL7 tends to include many elements that are used in some limited circumstances, whereas FHIR can use extensions for those circumstances. HL7 and FHIR both provide formal mechanisms for defining profiles to give guidance on the use of the specification. However, the HL7 mechanism has not been widely used. So FHIR allows for quick, easy access with downloadable applications and was created with EHRs in mind in order to be EHR compatible, therefore promoting interoperability. So as defined by HL7, the foundation of what is FHIR is grounded by the following principles. So they want to prioritize implementation, provide a flexible framework for interoperability, keep complexity where it belongs, and support but doesn't mandate tight specifications. These guiding principles are put in place to help the standard be strong and resilient to various technological advances that occur over time. So the FHIR standard allows for different architectural approaches, and you can use these to gather information from a modern or a legacy system. So let's take a look at the applicability of FHIR in healthcare for providers, patients, and also developers. FHIR for healthcare providers creates a smooth pathway for connecting to third-party applications directly from your EHR. Basically, you're not logged into your specific system and the integration it provides. You can also launch your own apps by contracting development to a vendor. With FHIR standards, this won't be as expensive or as time-consuming. FHIR also makes sure that data will always be maintained in a consistent manner in all of its sources. So for FHIR for healthcare software developers allows developers to focus on the value their products bring, not the implementation. HL7 provides clear and detailed documentation, and the community also shares numerous free tools and support, including the ability to use common web standards like XML, JSON, HTTP, and OAuth, which allows programmers to build apps quickly and painlessly, even if they're not familiar with the healthcare domain. So what about FHIR for patients? FHIR delivers to patients a full overview of their clinical data. One handy example is the Apple's Health app on iOS. So that uses FHIR to pull patient data from EHRs and other health institutions, combined with the data generated on the patient's iPhone, and creates a holistic visualization for that patient of their health. This seamless access to the information drives patient engagement and also updates them on any lab results, allergies, medications, procedures, and more. So now that we've seen the high-level benefits of FHIR for providers, patients, and developers, what could FHIR mean to your practice on a day-to-day basis? The benefits range from data accuracy, data security, data analysis, some medical applications that might be a little bit better, decreasing some billing errors, more time for patients, and less work for patients. So we're going to kind of look at each of those individually. So with data accuracy, during data exchange, without medical standard FHIR interoperability, it is likely that mistakes, shifts in data will occur. Diameter Health revealed that 80% of allergies aren't coded correctly in EHR systems. Such mistakes can result in wrong treatment, which can be critical for patients' lives. Data accuracy provided by HL7 FHIR standard will definitely help healthcare institutions avoid such events and save patients money, time, and their reputation as well. So with data security, FHIR ensures secure data transfer due to a solid foundation of such web standards as XML, HTTP, ATOM, OAuth, and JSON. These standardized data sets are also compatible with many security tools. With APIs connectivity, healthcare providers will avoid manually filling the information in different platforms, which minimizes the risk of breaching. Also with data analysis, it can be hard or impossible to analyze the data of different formats. When resources are standardized, entities can start to use big data to better understand the state of population health and consequently recognize crises earlier and handle them better. It is also a sufficient ground for some scientific research. With better medical applications, along that with APIs, integration of EHR, EMRs in an application will become much easier. The quality and benefits of medical applications will increase while all aspects of an entity can be handled within one application. Billing, staff schedules, e-prescriptions, drug control, the list goes on. Patients prefer institutions who utilize the power of technology that will enable them to review their lab results, their prescriptions, create appointments, etc. On the same side of that, if we have the ability to decrease some billing errors, if the data is transferred in the wrong way and any mistakes occur, it could be the effect that is critical for healthcare facilities. One mistake could cause, not cost, but much mistakes tend to accumulate and skyrocket the cost of billing errors in the long run. According to statistics, billing mistakes cost hospitals $68 billion each year. More time for patients is an added benefit if medical personnel don't have to waste their time figuring out the data transfer. They don't have to send and receive faxes and entering the same information into different systems. They could be able to connect more with the patients and provide better services. Interoperability will also decrease the chances of burnout since people will manage work-life balance better as well. And lastly, less work for patients. Patients aren't going to have to fill out numerous paper forms every single time they visit a hospital, and they will also avoid explaining their situation over and over again to every doctor or nurse or consultant who does a follow-up. Due to the current complicated data exchange, many physicians will either need extra time for faxing the medical record or finding the desktop to view it on. It is easier to ask. Interoperability will allow different institutions to exchange data freely and gain access from anywhere. So now we're going to take a look at the actual structure of FHIR APIs. FHIR development is composed of core data elements called resources that are combined through references, which cover most user cases. In the scenario that appear in specific health domains, they may need supported by an extension mechanism called profiling. In order to fully understand the relationship between these FHIR components, we're going to take a look at each of them individually. So the main structural element of a FHIR solution is a resource. Resources are packets of information used to exchange or store data that satisfy most use cases in the clinical settings. Think of it like this. A resource is a building block. For example, a resource patient covers demographic and administrative data about a person receiving care. There are dozens of resources covering different aspects of the healthcare domain, from scheduling and patient management to medical billing and information tracking. Resources can be represented in multiple formats, and they define what data will be shared using the resource. They can also control normal text with explanation. So resources are the basis for all exchangeable FHIR content. Each resource includes a standard definition and human-readable descriptions about how to use the resource. Each resource also has a set of common and resource-specific metadata or attributes to allow it to be used clearly and unambiguously. So FHIR resources can store and or exchange many types of clinical and administrative data, which again is that foundation for the data model used in quality measurement. So above is just a simple example showing the important parts of a resource. You have your local extension, your human readable HTML, and that standard data. So now that we've looked at those resources, let's talk about our references. FHIR references are how different resources connect. Resources are very rarely used independently, and they're going to require a reference to another resource. Using references, resources are combined to build the structure that is healthcare information. So now let's look at our profiles. So a profile is a FHIR resource that has been changed to meet the needs of a specific use case. For example, the FHIR observation resource can be used to indicate anything observed about a patient. To indicate vital signs, a vital signs profile is required and providers greater structure by listing specific data, blood pressure, respiratory rate, etc., along with appropriate coding for the specific data element. Using that vital signs profile in EHR avoids variations and makes data sharing much easier. Multiple profiles are often assembled into implementation guides that can be easily consumed. As an example, QI Core is an implementation guide that contains profiles for representing the clinical data in an ECQM. Another example would be the CMS Blue Button. Blue Button is the Centers for Medicare and Medicaid Services FHIR API that supports data exchange for Medicare beneficiaries. Their implementation guide lists the profiles for different scenarios: carrier claim profile, coverage profile, inpatient profile, etc. Under each profile, you can see what elements and value sets you might include in the resource to use this profile. Profiling is one of the most challenging tasks of FHIR adoption. It requires an intimate understanding of all FHIR resources and the technical aspects of implementation. So to facilitate interoperability, a tool with built-in profiles was created. So let's talk about Smart on FHIR and why you may want to use it. So at some point during the process, someone asked themselves, if only there were sustainable medical, substitutable medical applications and reusable technologies that allowed hospitals to try out solutions from various developers until they found what they needed. Sounds like a smart idea, right? Sorry, had to happen. SMART, which is an acronym for substitutable medical applications, reusable technologies, was created in 2010. It started with a $15 million grant from the ONC with the purpose of building a standard framework that allows the development of interchangeable healthcare applications. SMART was a standard initially developed to solve the interoperability problem similar to what FHIR did, but FHIR gained the healthcare community's support first. So instead, SMART shifted the focus towards helping with FHIR implementations, namely creating tools and guidelines for developers building FHIR-based apps. In so many words, Smart on FHIR is a project providing two products: a framework for building FHIR-based applications with supporting documentation, sandbox environments, software libraries, other tools, and also a platform to publish and access FHIR apps. So Smart on FHIR delivers double value. For physicians, hospital CTOs, and patients, it provides a seamless and low-cost way to integrate with hundreds of products on a marketplace. This ability to easily replace apps should drive the innovation process and create a competitive market similar to the travel industry or financial mobile apps. For developers, it gives a tech stack of concrete open specifications and profiles used to express specific types of data: medications, allergies, prescriptions, and conditions. Basically, SMART makes choices about data representations, usually based on standard codes like SNOMED, leaving less work for developers. So what else can Smart on FHIR create the ability to do? It can define a mechanism for interoperable quote-unquote smart apps that can be plugged into EHRs and other health IT systems. Those can then expose a user interaction and can access data in the underlying system. This creates a powerful way to extend EHR capabilities. So at the moment, the majority of health information exchange and data interoperability is based on documents, whether that be faxed, emails, sent electronically. Providers typically have to choose a set of data to transmit and then generate a message that contains only that data. While this approach does help organizations successfully communicate, it can be limiting for meaningful care coordination, decision-making, or data analytics. For example, the CCDA, as we all know it, is a standardized document format that contains a great deal of critical information, but it is similar to a PDF. That is, that the data is relatively static, and it takes a special effort to extract the information and make it usable in any other format. Using standardized application program interfacing, or API standards, FHIR allows developers to create apps that transcend this document-based environment. Applications can be plugged into a basic EHR operating system and feed information directly into the provider workflow, avoiding those pitfalls of document-based exchange, which often requires providers to access data separately. So now that we have covered the basics of FHIR, I'm going to pass it back to Lindsay to discuss how NextGen can play a role in this developing healthcare topic before it gets too hot in here.
Great, thank you, Holland. I also think it is safe to say we have been spending far too much time together prepping for this webinar, and the bad joke tendency, well, I think they're good jokes, has rubbed off on you, but I'm here for it. So let's go ahead and wrap up today's webinar by looking at what NextGen specifically is doing with APIs and what you need to have in place to be compliant. So NextGen has multiple APIs and API programs in place that we'll cover. These include the Enterprise API, the Patient Access API, and then they have their Open Access Partner Program and their Premier Partner Program. So we're going to start with NextGen's Enterprise API. So this Enterprise API enables you to enhance your patient's existing health information using an application of your choice configured to meet the technical specifications of the NextGen Enterprise EHR. So this Enterprise API is actually a proprietary API written to NextGen Healthcare's database schema. And this API can both read and write data from the NextGen Enterprise EHR. So think, this API is going to allow applications to access NextGen Enterprise, aka your EHR system, and be able to read and write data from it to benefit you as the provider and your practice. On the flip side, the Patient Access API is a FHIR-based patient access API for developers creating apps intended to empower patients with access to their own personal health data in a NextGen Enterprise practice. So this is going to enable providers to provide their patients access to their health information using an app of their choice configured to meet the technical specs of NextGen EHR. So patients can use a smartphone or some sort of web app to access their own health information straight from your NextGen EHR system. And this Patient Access API is based on those FHIR standards from HL7. So you can see this is different than the Enterprise API because it's going to allow patients to access their health information directly from the EHR. So what can this do? Well, for example, it can allow health tracking or health monitoring web applications that can download information like the latest test results or diagnoses. It can permit compatible healthcare smartphone applications to access health records. You can also sync with applications that may access records from other providers and combine that information. And it can allow patients to access data through different apps as well. So who needs it? First and foremost, any client participating in the Promoting Interoperability Program. That's both the PI category under MIPS and or the Medicaid Promoting Interoperability Program. You should actually already have the Patient Access API installed and configured, but you absolutely need it by the start of your 90-day reporting period, which is at the latest October 3rd of this year. But to be honest, NextGen and Attentive recommend that all clients have this API installed and configured, since the regulatory deadline for the 21st Century Cures information blocking rule already passed. It was in April of this year. Now, this is not absolutely required, but very, very strongly suggested in order to be in compliance, since the rule itself requires clinicians to provide patients with access to their health information using an application of their choice. And NextGen has stated that this Patient Access API is NextGen's certified solution for giving patients that secure access to their health information to meet that requirement. So by installing and enabling the Patient Access API, providers using NextGen EHR can actually make the data set identified in that information blocking rule available to patients. So if you're wondering if you have this in place or not, there is an easy way to confirm if this was installed by following the steps on this slide. So you'd go to your API server and log into your API Management Console. We have the location there as well as a quick way to search for it. You would start the application, you would click Configure Patient Access API card, and you would validate which practices have patient API access. So once you reach the steps shown in that screenshot on the right to configure API access, you would just check the box next to the practice that needs that access. And then you would click Update and then Validate. And that will add the API for that practice. This slide is showing you how to add the Patient Access API, but doing it from a database perspective using SQL if you prefer that. We will be sending out a copy of the slide so you have this information at your fingertips. We don't need to go through it. If you do not have the Patient Access API installed, you can request it at the link on this slide. Just a heads up, you should be on version 5.9.0 or above to install it. So once you verify it's installed and configured, patients can access their clinical information by using a patient app that follows the API specs of NextGen EHR. But what apps currently support the Patient Access API? So currently, there's 4. The first one is specifically Patient Link, their MyLink product. This MyLinks actually allows patients to electronically gather, aggregate, and share their personal health records with whoever they want to. It allows patients to actually manage and edit their records, share them, store important documents, gather health records from multiple patient portals. You can actually manage multiple accounts. You can connect any sort of health devices or fitness devices, and you can even keep a journal. Then you have one record. This is going to allow the patients to do basically the same thing by building, one consolidated medical record with their full health history. It's going to include the test results, immunizations, and really more from everywhere they receive care. Then Coral Health, again, consolidates those records. You can track medications and set medication reminders and monitor some health trends. So it is more medication focused as well as, family record management as well. And then last is my FHIR, my FHIR, I'm not sure how they pronounce it. This is kind of the same idea of a one-stop shop for medical records, but it also includes things like symptom tracking as well. So bottom line, each of these apps support NextGen's initiative to connect patients with their health records in a connected, secured, and organized manner. And they already have a partnership with these 4 companies. And there are opportunities for more apps. NextGen has 2 partner programs in place. The first one is the Open Access Partner Program. So this is going to focus on developer organizations and current clients that have or are developing API applications that are compatible with NextGen. So if an API is developed with the program, within the program, and it's actually believed to be beneficial for other NextGen clients, NextGen's going to offer that developer the option to become what's called a premier partner in order to release that app to the NextGen healthcare community. So the Premier Partner Program is kind of a level up in the sense that it's a full service development platform. It's going to provide all the tools and documentations you would need to develop and launch an API app to the NextGen healthcare community. And these are also going to be featured on the API marketplace. So the NextGen API marketplace is going to showcase APIs that are compatible with NextGen and allows developers to create their own apps that can both read and write data to NextGen. So this, once you're on the API marketplace, you can enrich existing EHR data through apps. You can sign up with NextGen and create your own app. Again, that can both read and write data. Currently, apps like the ones you see on this screen have used this and partnered with NextGen. So you have a bunch of different ones here. Some of these include Aspiria. This is going to be a multilingual conversational texting. Its efforts to reduce no-shows and improve preventative care recall. You have Bird Eye. This is interesting. It's going to help providers get more visibility online. Call My Doc identifies patients who actually phone your practice and call them back automatically, and then self-documents all the patient phone calls in NextGen. You have other things like the EHR barcode reader, the Kina. It's, this is going to capture vaccine and medication data directly into NextGen. You also have Podium. This is going to be a patient messaging platform that helps practices actually connect with patients at critical touch points. So things like that. Different apps like this that are already on the API marketplace right now. Now, if you know of or use an app and you want to recommend one to NextGen, you can do that as well. You would just do this through the Success community, and you would be doing that by posting an idea. On the flip side, you may not be the only ones with app suggestions. Your patients may have them too. Remember, patients can request their health information through really any format that they want it via this new rule. So now it's your practice's choice to allow that third-party access to your data. Now, when we say third-party access, we mean that a non-patient could access patient data, which is scary. However, you can't really disallow this unless it falls under one of the 8 information blocking exceptions we mentioned earlier in the presentation, and that's why I included them. So it is your choice to allow that access, but you can't really not allow it unless it's one of those exceptions, so keep that in mind. So with this, again, kind of hitting on a lot of the same things that we discussed in the last slide, so I'm not going to read all of it, but it's going to be a helpful reference when we send out the slides of what to do for third-party vendor requests that are not patient authenticated, and then also for patients specifically requesting electronic access. Since this is, kind of intimidating, obviously, to allow such, access to your EHR and to your patient information, and since it is up to the practice technically, NextGen did put out some guidelines on how to vet an app. So for patient-facing API applications, these are going to be the web or smartphone-based applications for patients who want access to their health data. NextGen can vet to a certain degree that they're a legitimate vendor. They're going to check things like their website or validate their email domains. But ultimately, practices have to allow patient electronic access to their data from an app as long as it's followed the regulations for authentication and authorization. So some of these vetting practices, like I said, NextGen's going to validate that the vendor has a legitimate online presence for their app and its intention, and that it has good intentions, as well as data access requests. However, they are regulatorily required to provide documentation to any patient-facing app vendors for connectivity and providing authenticated patients access to their data. So they have to provide that documentation. And NextGen has said they're not going to discriminate against any vendor, even if they're a competitor. However, it is the client's or your practice's responsibility to do your own vetting to determine if that app meets your practice's business needs as well. So with that, NextGen again did publish a really helpful section on recommended application vetting practices. And it included questions to ask a vendor. So that's where we took that screenshot from. So some of them include, I would ask a vendor, how many NextGen healthcare clients are you already working with? How long have you been working with those NextGen clients? How many are in production versus test? Do they support your current version of NextGen? How do you handle PHI that's been accessed by your app? And what do you do with PHI if we stop doing business with you? I think it's fair to say these are all crucial things to know, and the app developer should have an answer to all of these for you. All right, well, we have made it to the end of our kind of crash course here in APIs and FHIR and healthcare. So the goal by the end of this was to understand this graphic, what it means, how it really works, and be able to engage in an intelligent conversation on it with our peers. Now, I'm confident I can do this now. I can finally stop, living a lie, and it feels good. So the true test I had for myself was if I had to use these 3 words in a sentence, now I would know how. So APIs using FHIR standards are going to work to actually advance or achieve interoperability in healthcare. It is that simple. And again, I understand now it's simple, and how we got here was a long, long pathway, lots of words, and it could have been overwhelming. So if you are feeling overwhelmed and you want some next steps, or if you need any technical assistance, or you're just really not sure, if you're doing things, if you have things in place, we do have a technology and performance focused assessment in addition to our extremely popular EHR and PM ones as well. Continue to sign up for our webinars and view our blog, as well as our LinkedIn. We've been posting a lot of technical tips that would help with things like this. And if you have any other needs outside of this, don't hesitate to visit our website and learn more about what we do and how we can help, including our add-on products. There are some new ones on there if you haven't checked in a while. And finally, questions. So we have our contact information up on the screen. If you have to jump off and want to email us a question, or if you would like to learn more about us, feel free to use those emails on the screen. I'm going to turn over to Chelsea to read out any questions that were put in the chat. But before I do, I want to say thank you for staying on, even when I confessed we were not experts on this topic. And with that in mind, I'm going to be completely upfront and say we may not know the answer to your question right away, especially if it's technical. Again, we're not the experts in the API field. However, we do have members on our team who are. They're just extremely busy and they couldn't jump on today. So I will consider myself and Holland experts in finding answers no matter what. So with that, Chelsea, feel free to start with the questions.
Okay, perfect. I will. And as a reminder, you can type any questions that you have in the webinar control panel. We're just going to go through them in the order that we've received them. For a couple of these, I also might pull in Cindy Kincaid to help answer them. I'm sure that many of you have met Cindy. She is our Vice President of Client Solutions at Itenov. And And so we're gonna phone a friend when we need help with some of these. So the first question, can you discuss the difference between the API and NextGen share and CCDA transmissions?
Yes, kind of basically, it's really hard to tell the difference because honestly, you are transmitting and sharing data with both of them. But NextGen Share is really a Mirth and Rosetta special instance. It is not using an API, whereas if you take some of the other NextGen applications that are out there, such as NextGen Mobile or the new PXP portal, patient portal, those are using the NextGen API. So those could get kind of iffy, but NextGen Share is not technically an API, so you can use that without having the API installed, whereas if you're using any of those other two products I mentioned, you would need to have it installed. The CCDA transmissions can occur with both of them, but it's likely being used right now through NextGen Share, which again does not require the API.
Great, thank you, Cindy. Next question. This information blocking rule seems extremely tricky for our practice when it comes to minors and their parents accessing their records. Do you have any recommendations regarding issues of credentials for API access by minors?
I can grab this one. This is a great question. We've gotten this a lot, and NextGen also just issued guidance on this that we actually reviewed before this presentation because we figured a lot of you would be asking this. So specifically, NextGen's going to recommend that all patients should be given unique access information, so a unique user ID and password regardless of age. NextGen has stated they don't recommend having a parent set up a minor's access rights. You know, it's up to the practice to determine whether your state has any specific requirements that are going to prohibit parent access to that minor's information. So we absolutely recommend that you work with your privacy officer as well as check for alignments with your notice of privacy practices that you have in place. It's also important to note that once you log into an account from an application that's configured with that patient access API, clinical information, including sensitive information, is going to be available. And then for caregivers too, not just minors and parents, but kind of the reversal here for caregivers of elderly parents, we recommend that each patient, you know, again, also be given a unique set of credentials.
Great, thank you, Lindsay. Next question. API server, how do I find mine? Cindy, do you want to grab that one?
I can grab that. I can't tell you how to find it. So basically, no, I mean, not everyone has an API server. NextGen recommends that you have an API server, but some of them are putting the APIs on the communication servers, but it is creating some challenges with performance. So you would need to check with someone, or I can put you in contact with one of our network individuals who could actually tell you how to look it up. But if you don't know how to find it, you likely don't have one.
Great, thank you, Cindy. Moving on. Will HL7 interfaces go away or be forced to be replaced?
I can also grab that one. I don't think they're going to force to be replaced, but they're becoming increasingly obsolete. And as things continue with security and the open operability that everyone is being forced to, particularly with the Cures Act, I would say that it's something you want to start looking at as down the line, but there's no indication that there's going to have to be gone by a specific date. That may change, as we all know, regulatory is changing all the time, but at this point, it's just really more that it's becoming obsolete as new applications are coming out. We all know that sometimes you have to put Mirth in between your HL7 interfaces or your Rosetta interfaces. Sometimes you have to have things that you can't configure that you can't in the standard interface. So more and more, they're becoming obsolete, and you're needing other applications to be able to handle it.
Great, thank you. Next question. I have tried these 4 apps and they do not have all of our locations in their apps as available to access.
Okay, that is probably coming from the NextGen Marketplace. I have heard from others that they can't really access some of these and that some of them don't work as perhaps advertised. NextGen is currently working on that and updating that. So while we can tell you the ones that are out there, you would need to speak to NextGen directly or the companies directly to be able to address that question. I also know that participating in a lot of the meetings with NextGen, being a NextGen preferred partner, that they are currently working on modifying and improving the API marketplace. So you will be seeing some changes coming down the pike with those.
Okay, thank you. Do we need a BAA on file for each app developer?
The answer to that question is yes. Now, some of them, as you get into when you were looking at those, we all kind of went with some things that you were and when we went through the pandemic and everybody had to go to remote learning, and you were using Zoom and a lot of things, and people were wondering if you had to have a BA with those applications. They actually came out with verbiage that I think you could agree and sign that. Once again, you'd want to talk to your compliance department, but the answer to that is yes. You have to have an API for a BAA for anyone that you are sharing medical data with or working with as a vendor.
Okay, thank you. Looks like we have about 2 questions left here, so if you have any questions you're sitting on, feel free to ask them. We'll hang on until the end in case people are typing, and again, we still have 2 more to go through. But if you don't want to ask them here, again, you see both Lindsay's and Helen's information up on the screen. You can feel free to reach out to them directly, and as they promised, they would be happy to find you the answers. And you can always reply back to my emails as well, which will have a link to the slide and recordings. Basically, any way that you can get a hold of us, we're happy to help. That's why we're here, so don't hesitate to reach out to us. Okay, next question. APIs just sound like an interface. How are these different from my existing Rosetta interfaces I already have in place?
So I can grab this one. It's a great question. And honestly, I mean, the I in API stands for interface, so I understand the confusion here. But specifically between the Rosetta interface and an API, there's really 3 main ways that stick out. So the APIs are designed to be called directly by an application and access targeted parts of the healthcare record. The API is also going to offer some enhanced security features and multi-practice access that's unique to the API itself. And then also, emphasizing the API is unidirectional. The API is going to, only receives calls from an external application. It's not going to be that bidirectional that we're used to with the Rosetta interfaces.
Okay, thank you, Lindsay. And it looks like this might be our last question. What if my patients have questions on API access? How do I answer these?
This is a great question. If your patients are coming in with questions and they have questions, on how to get access and how to use an app, you can direct them. NextGen actually does have a patient-facing API access webpage. Basically on it, it's going to say that the patient needs to have a patient portal login to your practice, and if they don't, you're going to have to register them. And that if the app they've selected needs some sort of connectivity information, it's actually provided on that website that they can download and give the app developer themselves. You can kind of stay out of it a little bit hands-free, give them that resource. And then once a patient's connected, if they're still having trouble with the app and they come to you, you're able to just direct them back to the developer to get the answers once they're actually connected and got everything through. So, in a roundabout way, I would say you shouldn't have to answer too many questions. I would just provide that NextGen facing resource, that web page would be your main go-to.
Okay, great. Well, thank you everybody for joining us. I hope that you enjoy the rest of your day. And again, keep your eyes out for a copy of the slides and recording. We'll be sending those out shortly here. And keep your eyes out for future upcoming webinars with us. Thanks for joining us.
Thank you, everyone.